Welcome to another program in our series, Freethinking Forum. My name is Bill Weir. I'm the producer and host, and I'm delighted to have with me today my friend Wallace Swan. Wally, you've got 3 degrees, and you're teaching public policy, administrative ethics, public and nonprofit finance and organization theory at a number of universities, including 4 in this area, the metro area. You've had over 30 years of government experience in city, county, state, but not yet the federal level.
No.
And you're teaching from time to time on the faculty of 2 of those Masters of Public Administration programs. So, and also importantly, you are a member of the board of All God's Children Metropolitan Community Church, and you're active in bringing together the healthcare services under the new name Just Us Health. Mm-hmm. Oh, and not to be forgotten is that you are in the new edition of Who's Who in America that's coming out right now. So, Wally, you've had a distinguished career, and I understand that you now have a book that you have edited as well as contributed a number of chapters to. Mm-hmm. Would you tell us about the book?
Well, the book is called the Routledge Handbook of LGBTQIA Administration and Policy. It's published by the Routledge Corporation, and it has the Taylor and Francis imprint, because Taylor and Francis was absorbed by the Routledge.
Now, this is about the United States, is it?
This is United States, but it also has a chapter on international as well.
Oh, good. So and it's published in England?
I know the editing was done in England, a lot of it, yeah, but I don't know where it is published. I'm not familiar with that.
So tell us more about the book.
Okay. Well, first thing I want to mention is what those terms LGBTQIA mean, because everyone asked me that question. And it's lesbian, gay, bisexual, transgender, queer/questioning, intersex, and asexual/allies. And we also should mention that Two-Spirit people who are Native American are also included in this.
Several tribes in America use that?
I'm not familiar with it. I know that's the terminology that's used for Native Americans throughout the...
And this is the cover of the book, isn't it?
Mm-hmm.
So
it's being printed actually in the last day or 2. And then it'll be sent out in end of November.
What is it about?
Okay.
There's so many topics.
Well, I'll talk a little bit about each one.
Good.
So that you get an idea of what the issues are. The first one is a complete listing of all changes in public policy resulting from the new federal administration's efforts to eliminate LGBTQIA from the federal agenda. And some examples of that are that they have essentially eliminated lesbian, gay, bisexual, transgender from all of the websites in the federal government, almost all at least.
Why?
That's the position of the administration, that all of that is to be eliminated.
Denying this minority that's substantial?
Another example, of course, is that the U.S. Census 2020 definition was to include LGBT people to be counted for the first time. We've always had couples since about 1990 or so, but they were couples that are 2 men living together, 2 women living together, which isn't necessarily accurate. So they kind of honed that down, and they've got that much more systematic in the new count book. But what they did was we wanted to count everyone that's LGBT.
Yeah.
And
whether they're in a couple or not.
Exactly. And what we found was that the 2020 census data book does not include LGBT people except for the couples. And the way that we know that it was originally in there is when they took out LGBT from the census book, they left it in the appendix, in the index. So we knew it was going to be there. So
Previous administration had it in, and they,
yeah, that's right. That's what happened.
Trying to ignore those
But
folks.
I knew this was happening, and so as a result, what I did is I went to an organization that's called the Williams Institute, which is the leading think tank in the LGBT community. It's at UCLA and the law school. And I asked two of the leading people there to write a chapter about how many LGBT people there are, since I figured the federal government wasn't going to do it. So they did. They took it out of the 2017 Gallup poll data, and
good.
they got everything that you could ever want about LGBT people: age and race, sexual orientation, as well as a variety of other, everything that you need to identify. And got the actual, I've been able to figure out pretty close to the actual numbers of people. We don't have an accurate count of bisexuals because that was not included in the Gallup poll data, but the national data shows about 30%. And the LGBT population is about, I remember, somewhere in the neighborhood of about 4.3% of the American population.
T for transgender.
Transgender, right?
Yeah.
We know how many transgender people are, 1.7 million. We know how many people are in couples that are lesbian, gay predominantly, that's 1.6 million. And subtract that from roughly a total of about 14 million from according to the data. So we kind of did an end run around the federal government that way.
Well, good. You found a way.
Yeah.
So this could be a useful handbook in many ways.
In a lot of ways. Yes.
What else?
Another thing is that because of all of these changes that have been taking place at the federal level, we have one federal government, but we have a lot of city, county, and state jurisdictions, somewhere in the range of about 80,000. So one of the chapters in the book is recommending that since we are not making any progress at the federal level, we'll do what we did during the Reagan administration, which is we reposition ourselves to make progress at the state, county, city level.
Good.
And that's the way to go around what we're dealing with now. Some other things that are in the book, there's 3 chapters on transgender public policy. Got a person who actually spearheaded the effort in Anchorage, Alaska to protect their legislation in Anchorage that allows transgender people to be treated fairly. And she essentially stopped the movement of the people who wanted to abolish that freedom. And so she wrote a brilliant chapter, and I've got 2 other chapters in there, including 4 of my students from my Master's in Public Administration class who decided to write about transgender policy because it was something interesting that was happening. So that's kind of a neat feature. I like to involve graduate students, I like to involve people who are practitioners, as well as academics.
Good.
Because sometimes we academics are a little too, boring, and I like to get the real world into the book. So,
Well, I haven't found you boring.
okay, well that's very nice, thank you. We have another chapter in the book. It's the first one that I can tell that has been published on federal intersex public policy, and that's the reason I put the I into the title, because one of the people who is writing in the book is intersex. And
what is the meaning of that?
intersex is a person who has the body parts of both male and female.
Really?
And what happens oftentimes, without asking the person when they're born, the doctor will arbitrarily assign the sex and eliminate the offending organ.
Really?
And that's something that's very traumatic, of course, for the person, but they don't even know it because it's right at the time of birth they make that decision. But there are a fairly large population of people who are intersex, and I got the explanation of it when I sat down for lunch with the new officer of my national association, and the person said, well, I'm intersex, and they explained it to me. And I said, well, I thought about that for a while, and I thought, I've never had a chapter on intersex, and I've never seen one. And so I asked the person to write the chapter, and it's in the book. So
Good.
this is a real cutting-edge book in a lot of different ways. We got a really good chapter on LGBT youth, which is a very powerful issue because of the fact that about 30 to 40% of people who are homeless, who are youth, are essentially gay and lesbian or bisexual or trans. There are a lot of people that are suffering in that condition of homelessness because they've been thrown out of their homes. It still happens. And so that's a very interesting chapter. I've got a chapter about same-sex couples. And as I said, there's about 1.6 million people in a same-sex couple. I think there's like 880,000 plus couples. And there are also a lot of LGBT singles. And singles, according to the census data, I was able to figure there's about 11 million singles, roughly in that range. And there's different issues that face the single people as opposed to the couples. We know a lot about the couples because they've been counted, as I said, since about 1990. But the singles have never been counted, and we have no data about them. That's what's so powerful about this Gallup data, is it tells us a lot about the whole community and not just one piece of it.
And some of those singles may be a mother or father of children.
Could be, sure. There are some.
That can be quite a challenge.
Yeah, and there is, I should mention, of course, that there is quite a movement in our community to for kids to be adopted or take, foster care or whatever. I have a very close friend who has like 3 or 4 kids that were foster care and that just were adopted. So yes, there is a movement in that direction, a large rainbow family movement that we call it. So. Also, I have a really good chapter on bisexual issues. One of the major problems in the bisexual community, according to a friend of mine, Victor Raymond, wrote the last chapter in the last book that I edited. It's called Bisexual Erasure. If a person is attracted to both male and female people, then the effect is that in terms of the data, it shows a very high percentage of people with mental health problems, problems of all kinds of substance abuse and all of those things, because they're caught between the two cultures, the gay community or LGBT community and the straight community. And they're kind of in the middle, and each one of them is saying, it's invalid what you're doing, that you're attracted to both.
So
and
they're outcasts.
And so they end up having lots of problems. And in comparison to the transgender community has the biggest set of financial problems. They have 4 times the number of people that make less than $10,000 per year. Bisexuals are kind of the next group after that also suffer from this stigma.
Next group meaning a little more income, but...
A little more income, but still a lot of issues. Have another chapter, of course, on our battles with the federal government on LGBT data collection, which I mentioned earlier. But we had one survey that was on seniors, and what they did was they took out the questions on lesbian, gay, and transgender people in the senior analysis. And so we wrote letters. I wrote a letter personally on the Federal Register, proposal to eliminate lesbian, gay, and transgender people. And they reinstated lesbian and gay people into the count. So they're counting them, but they wouldn't count the transgender people, which is just...
ridiculous.
Yeah. And there's another chapter. You remember I said that it's LGBTQIA, and A can mean allies. What we did at the American Society for Public Administration, where I'm chair of their Advocacy Action section, was we worked with people from marginalized groups. We had a big assembly of people, including women and African Americans, Hispanic Americans, Asian Americans, as well as LGBT people. And we set up tables where we could explain to other people some of the issues that face us. And what we did, and it was kind of my idea, I suggested that what usually happens at these conferences is all the LGBT people go to the LGBT session. And I said, we want to have the people that come to this event be randomly assigned to whichever one of the tables they end up at randomly. And as a result, LGBT people went and learned about African Americans, or they learned about Hispanic Americans, and women came over and learned about LGBT. And so that's kind of the model that we built at this national conference. We had like 125 people there. Good. And it was very successful in building the kind of coalition that I think we need in this country at this point in time.
Yes, important thing that we understand other people's points of view,
right,
and the experiences they're having, some of which may be quite different than our own.
Exactly. There's a chapter in the book about LGBT adults and seniors who are homeless. Now, all of the literature, in my last book in 2015, what we found was that there were 30 to 40% of the youth were homeless, and so there's been an enormous literature that's grown up about LGBT youth homelessness.
Yep.
The problem is that we also have LGBT adults and seniors who are homeless. And there are a lot of different reasons. I can think of a couple of friends of mine. One was in a couple, they lived in an apartment, and then suddenly they were displaced because the partner died. And they ended up homeless because of the lack of income to be able to support that place that they were staying. And it's just, like a one-bedroom apartment, and you know how expensive, one-bedrooms are in Minneapolis.
But there are places where the rent is only 30% of the income.
Yeah.
And I live in one of them because I'm in somewhat poverty too.
Well, I understand that perfectly, because I have a number of friends that I have made their acquaintance, and what they end up doing is they end up being in apartments with several other people or whatever, and if one of them leaves, then sometimes they're out on the street. And another problem that we have with seniors especially is, as these units get built, these very expensive ones downtown, they take the building, they convert it to a condo, and then the person can't afford to get into the condo, and so they're gentrified out of their living situation. So what I did was, Rainbow Health Initiative had a study, and does it every year. It's called the Voices of Health. And what they do is, at all of the LGBT pride festivals around the state, we have about 8 or 9 of them, they collect data about all kinds of different things about LGBT people, and one of the questions is about homelessness. Well, we're finding that there is somewhere between 1% and 7% of our LGBT seniors and adults are homeless. And so that's one of the issues that's a real important one to our community. And that's why I put this chapter in there, because nobody else will write it. Then Rajeen Moon, who's a professor.
Excuse me, I wanted to ask a question. I get the impression that maybe military veterans would be a large percentage of the adult and senior homeless people. Is that true?
I've never seen an analysis of that, I have to admit. Yeah. But I do know that a lot of our people who are adults and seniors have served in the military. I've got several friends that have, so I know that contingent is out there.
I'm also producing a series on military veterans once a month.
Sure.
And trying to come out with some valuable information for the veterans, including the information about the new veteran center in Brooklyn
Oh, yeah,
Park.
sure, sure.
So,
Another thing that's in the book, as I was going to say, is on senior issues. And Rajan Moon, who is at the University of Minnesota, a social work professor, spearheaded this effort. There's like 2 other authors working on it. And he's pulled together all of the data about LGBT seniors and what the issues are in the country. So that's a really important chapter. Then one that's very relevant to Hennepin County, since we're in Hennepin County.
well, it may be relevant to many other counties too that want to emulate.
Oh, yes, absolutely. This study is fantastic. It's called the SHAPE study, and it has a sample size of about 7,000 people, which is a huge sample.
Oh, yes.
And it allows us to find out the percentages of LGBT people in Hennepin County.
What is SHAPE? That's an acronym.
I wish I could remember, but I'm sure that May Ding, who is one of the leading writers on this, could give that quickly, but I'm not able to.
We'll save that question for another time.
Yes, but what's important about that is the percentages in this study of LGBT people are about the same as the National Gallup poll numbers. So the two kind of verify each other. It's kind of nice.
And does it go into more detail than other studies?
Oh, it's an incredibly detailed thing, and it tells you things about the issues that are faced by LGBT people. High percentages of substance abuse, and that's a result of the pain that people experience. There are high percentage of depression, anxiety. I mean, they stand out because you can compare this, the non-gay community, non-LGBT community with the LGBT community, and you can see these dramatic health disparities that really need to be addressed, which is what Rainbow Health has been all about, is finding those and then calling them to the attention of policymakers.
Yeah. I wonder, is there some receptiveness, I wonder, to what is called co-housing, where the people live in separate apartments or houses, and they eat together at least once a week, maybe more often, and do some other things in terms of maintaining their lawn and everything else, as a kind of collaborative effort.
Well, I can remember at certain times in our community where that was a very popular style, and I know that sometimes there will be several people living together as roommates or whatever. In my case, I've got a roommate. My roommate is an astonishing person, originally from Rome, Italy, and works here. And just a brilliant guy, 2 master's degrees, and so we have a lot to talk about. So.
Good.
But it's usually, people will live with their partner, or they might live with several people together, but none that I've recently heard of that are in that configuration. It's kind of more out of the 70s or 80s, maybe. Yeah. Another thing that's really interesting about the book is the chapter on nonprofits. What we found is that after the U.S. Supreme Court decision on marriage, Obergefell v. Hodges, before that we had an enormous amount of money coming in from couples in our community, and spearheading that drive, very important thing. What's happened since that, though, is that some of the giving to LGBT organizations has gone down because they kind of achieved what they wanted to accomplish. And what that kind of has left us with is organizations, a lot of maybe, there's like several different levels of nonprofit organizations. There can be very small ones. I'm familiar with one has a budget of maybe $50,000, and our Rainbow Health Initiative had like $600,000. AIDS Project had one that was much larger, and the person who wrote this was helping to navigate that merger between those organizations. And so what we found was that after marriage, the giving to LGBT organizations went down, at least in the Twin Cities, and I've heard also around the country, about 50%. And that's because, you know, people kind of pulled back afterwards.
Yeah, we've achieved our goal.
Right.
But there's more.
The problem is that all of the problems are still there. The problems of substance abuse, the problems of cigarette smoking, which our community has been targeted by by big corporations, both on cigarette smoking and on use of alcohol. So I've got 2 chapters in the book about that. But that's kind of one of the reasons that I emphasize the need for acquisitions and mergers in the nonprofit community, because we're actually pulling one off that's successful at Just as Health.
Yes, and that seems like a very important process. And do you have experts who are good at mergers? Or?
Well, we're kind of learning. Just as Health has been able to do that, and we're merging with Rainbow Health and with Training to Serve, which is an excellent organization that does a fine job of training people, not only in this state, but around the country, on the issues of LGBT people when they go into nursing homes or assisted care homes or a variety of different senior organizations like that. Because I personally have gotten calls when I was in Primetimers, which is our gay seniors group. I got calls from outstate, essentially from greater Minnesota, saying, I don't know what to do. I'm in a nursing home and these people do not sympathize with me at all. What do I do? And that's why this training is so important, so we could train the staff of those facilities to know how to be comfortable with LGBT people. And they have trained, I believe, almost 1,000 different individuals and groups and so on.
In various
around the
nursing
country.
homes?
Yeah, they've done the VOA group
Oh,
organization.
Volunteers in America?
Yes, they've done the
of
whole
America?
staff of that organization.
Good.
And then, as I also noted, we have data on the issues of substance abuse, and that is a problem in our community because we essentially have been targeted by the big corporations that sell liquor, that sell cigarettes, and try to get people when they're young so they get hooked on the substances. And then we have a very large and very wonderful recovery community here in the Twin Cities where like in my church, we have a lot of these recovery groups centered there because they need a place to meet, and they're trying to deal with the problem that has been given to us by corporate interests trying to do this, selling liquor and cigarettes. So those are some of the major things that are in the book.
And do you have anything on hate crimes?
Oh,
Homicide?
yeah, I should mention that. Dallas Drake is the head of the Center for Homicide Research, and this very interesting organization, I used to be on the board. It was started because of the heavy prevalence of hate crimes against LGBT people. And they started doing essentially profiles of the kinds of people that were doing this and what the crimes were like so they could identify all of these profiles, and then you could identify whether the crime was a hate crime or whether it was just some other type of random crime. And there are certain characteristics, I've actually done training on hate crimes, certain characteristics of hate crimes that are definitely directed at LGBT people. And so this organization does creates these profiles and then trains people in police departments as far away as London and Australia. It trains people in the FBI. It trains people in police departments all over the country, and with a very relatively small budget. And it's the only homicide research organization in the entire country, and it's centered here in the Twin Cities. So the person who wrote the chapter is the expert on this, and he's written a chapter on hate crimes and homicide, but also another chapter that is a real cutting edge thing, which is the incarceration of LGBT people. And so he's done all the research that he could find on that topic and written a chapter about that, which has not been done very often in the literature that I'm aware of.
Well, it sounds like you've made a really comprehensive book there.
That's kind of what we tried to do, is make sure we cover almost everything.
It's more than a handbook. It's many chapters that need to be seen together in order to work on some of the problems that.
Right.
Now, is there anything more on substance abuse?
Well, we have 2 chapters on that. I've got one that emphasizes more kind of the theory of substance abuse and where substance abuse come from and what kinds of things need to be done as interventions. And then the other chapter is a chapter about how some of the interventions actually work, and some data about southern Pennsylvania, where this LGBT organization concentrates on trying to get people away from whatever substance they're dealing with, and why we have a higher recidivism rate in our community than non-LGBT people do, and they're doing a lot of research on that. So it's really helpful information to have.
Now, it seems to me we've covered many interesting parts of the book.
Well, there's one part I didn't really cover, and I'll talk about that a little bit, and that is why is it that we're having these initiatives directed against the LGBT community at the federal level? And where that comes from is something that I mentioned last Sunday when we were talking, which is we've had a number of bills introduced in legislatures around the country that are directed against the LGBT community. And there are about 6 different types of bills. There are at least 100 of them in 2017, even some in Minnesota, actually.
Well, yes, we were looking at this earlier.
It's HRC's Equality Index.
Yeah.
And it actually shows the numbers of people that are the numbers of bills that have been introduced in Minnesota each year.
And I see the good bills were introduced in 2010.
That's right around the time of the marriage thing, right before that.
Yeah. Yep. And but lately it's it's 16.
Getting more.
That's a fairly high number
Yep.
among all these years.
Well, let me tell you what the types of these bills are, because we have to deal with them, and we're going to be dealing with them more because they're starting to percolate up to the federal level.
Oh.
One of them is called religious refusal. These are bills that allow people to deny service to LGBT people because of the person's religious beliefs. So I walk into a store and I'm with my partner, and I want to buy a 7-Up or something, which I like to drink. And the person says, well, I'm sorry, I don't want to serve you. And I'm like, why is that? And the reason is because they have figured out that we're a gay couple and they won't sell to us because of their religious belief.
Huh.
And it really does happen.
I've heard about that on a wedding cake, but
yeah, it's a lot of other things can be affected by religious refusal. And I can give you a personal example from downtown Minneapolis. My partner and I went in. I got a $50 gift card to a restaurant downtown. And I decided that I'd use it for our anniversary dinner. It was our 8th anniversary dinner, actually. And so the woman said, oh, we do that for everybody that's in a couple. That won't be a problem. We'll give you the discount on the card, so you'll come back with, instead of spending $50, you'll spend like maybe 20 or something. She went back to the manager, came back just stone-faced and said, here's your bill. And the bill was for the full amount, not for the couple amount. That's what this does to individuals. And it was kind of funny because I was like, this is Minneapolis and how could this be happening?
Well, it's not a law here, is it?
It's not a law, it's just done. And, you know, I went out on the street and I said to my partner, I said, what was that? He says, that's two gays walked in and wanted dinner.
Huh.
He had it figured out in a minute. He's very perceptive. And I looked at that and I thought about it and I thought, do I want to file a civil rights complaint? Which, you know, under Minneapolis ordinance you could do. Well, that takes a lot of work. Sometimes you have to get a lawyer. You know, there's a lot of stuff that you have to go through, and, you know, the possibilities of proving that are 50-50 at best. So I kind of let it slide, but I made a mental note and told my friends where not to go shopping, where not to have dinner. But that's what religious refusal involves, is somebody deciding on the basis of the religious belief that they will not serve you. That's one type of bill. I'm sure we're going to have some of those in Minnesota. Another one that's
legislation?
Proposed. People do propose these things.
Yes, but do they pass? Do they get signed into law?
They haven't yet.
Good.
Thank goodness. Second type is what's called reparative or conversion therapy.
Oh.
And that's where a person, maybe a person's like 16, 18 years old, and their parents find out that they're LGBT people, and the parents take them and send them to a center for therapy. And there's a wonderful movie that just came out. I actually saw it last Friday about this, and it can be a terrible thing for the person. It's called Boy Erased is the name of this movie.
Yes, I saw that.
It's International Film Festival film,
Yeah.
And it's going to be here. I'm sure it's going to be around the country in the next few months.
Yeah, I haven't seen it yet, but I saw it was part of the Twin Cities Film Fest.
Yeah. That's one of the things we're working on very hard as a legislative priority right now, is to try to get the legislature to pass something that will prevent conversion therapy, because a number of other states have actually done that, 6 or 7, I think. There are lots of laws that have been introduced opposing transgender rights, and frankly, I have multiple transgender friends, and I think this is just a terrible thing to do to people, is to try to erase their personality, because they are born like who they are, and taking away all of the federal efforts that have been done to help transgender people, but also the medical community seems to be very much behind supporting transgender people. And these bills are just terrible.
Not the medical people are not behind the conversion therapy.
Oh, not behind conversion therapy, not for LGBT people or for transgender people specifically. They are very supportive of people who are transgender.
Yes.
Because they're helping them to cope with how our society treats them, which is not very well. Another thing is called nullification. It's also called local government preemption. And that's a bill which, for instance, in North Carolina, where they said if the state does not allow protection of LGBT rights, then you can't pass an ordinance in Charlotte that allows these rights to be given. So it reduces the possibility of having protection in many of the states around the country. So there have been bills that have been put together like that all around the country, trying to stop the protection of LGBT rights at the municipal or the county level.
I don't understand that. You mean that some municipalities, some cities, do prohibit,
do allow protections for LGBT people, but the state doesn't. And so the state says, you can't have a bill that is broader in coverage than we do at the state level. So like North Carolina ruled out transgender people and protections for them as well as LGBT people.
The only parallel I see in Minnesota is about the $15 minimum wage.
It's very similar. And that argument has been used on the $15 thing too. It's local government preemption. It's essentially saying, well, the state doesn't have a $15 thing, so you can't have it either. That's kind of the way this works.
And the city can't protect LGBT people unless
The state has the same sort of rule. Yeah. Well,
Terrible.
the problem is we've got. I've in my previous book I called them empowered states. There's 17 of those that have human rights laws protections. Then there's another 30 or so that do not have that protection. So if you live in Charlotte, North Carolina, or you live in Dallas, Texas, or you live in any place in the South just about, or that tier of states that runs from North Dakota all the way down to Texas, or the mountain states, if one of the big cities in those states passes a law supporting LGBT people, then the legislature tries to scope it down to just cover only the people that are covered by their state human rights law, which is very restrictive. So that's another. That's where all of this stuff is coming from. Is bubbling up in a kind of populist movement around the nation. And
populist. That doesn't sound too popular to me.
Well, populist is kind of a term that I'm going to give you a definition because it'd be more helpful. I was just having a discussion about this online with a friend of mine today. He says, well, this is not populist. The definition of populism is a political program or movement that champions the common person, usually by a favorable contrast with an elite. Populism usually combines elements of the left and the right, opposing large business and financial interests, but frequently being hostile to established socialist and labor parties. So it's kind of playing both sides of the street and arguing that the politician who's running for office is a person who's representing the common people. Now, this is happening not only in Italy and Hungary and Slovenia and Macedonia. It's also happened in the United States. That's
so does it
form
mean
of populism.
Is populism then kind of a rule by the majority, and which includes some things against minorities?
Especially against LGBT, but also African Americans, Hispanic Americans, women, and so on. That's kind of the thing that happens with populism. There's a quotation that I have, this wonderful quote that I gave my friend today as he was trying to tell me this wasn't populism that we were dealing with. I said, populism accepts the principles of popular sovereignty and majoritarian democracy, but it's skeptical about constitutionalism inasmuch as formal bounded institutions and procedures impede majorities from working their will. It takes an even dimmer view of liberal protections for individuals and minority groups. Now, I studied at Princeton for like a month a few years ago, and our Constitution was set up with checks and balances between the three branches of government, but also between the federal, state, local governments. Mm-hmm. And we have what the founders called a representative democracy. We elect someone who then represents us in Congress or in the legislature or whatever. And that's different than something that's based purely on democracy. And the framers were very smart about that. They were looking at this and they're saying, we don't want a whole mob of people making decisions for us. What we want to do is have it filtered through people who are representatives, who are smart enough to figure out what the answers should be for different questions.
And give a lot of their time to figuring this out.
And so
what is good for all the people.
That's the difference between populism and representative democracy.
And one of the geniuses of representative democracy is that there are clusters of people that represent minorities, that are
Exactly.
There may be a majority in a congressional district and be able to send a minority person to Congress.
Exactly. And that's kind of what we're dealing with right now, is some of the theories about how we got to where we are right now in this country. One of them is that you can have a government where the leader of the government speaks directly to these people through Twitter. And that's one of the theories, essentially, is that that's a populist mode of expression, because you can talk directly without the filter of the press or representatives in Congress or all of those things the founders built into the Constitution to protect us from populist behavior.
Well, does that mean that when we do communicate with everyone through tweets, that we're likely to end up with things that are discriminating against minorities?
That's essentially what Galston was saying, yes. Because what happens is representatives have to represent everyone in their district. And they have to talk to LGBT people, African Americans, Hispanics, women, and men. They all have to be kind of rolled into the decision-making process. And if you go directly and have that kind of unfiltered relationship, then you end up with eliminating the rights of minorities.
So maybe this is not just LBGT
Right.
issue right now, but it really is a part of the problem of our democracy right now.
That's kind of what we're dealing with. And we're not the only ones that are dealing with it. You'll notice that a new president in Brazil was selected on Sunday, and he is definitely a populist, and he is also definitely anti-gay. We're very much aware that the gay community is very frightened in that country about, the new president that they're getting. And he's talked about taking very dramatic steps to deal with the problems that are real in Brazil, like crime, corruption, and so on. The current administration, or the past administration, has been really not very good at that, and it's a liberal democratic kind of an approach to governing. But this one is a very hard right decision-making process, and that has picked him. So.
No, Wally, we've just got about another 10 more minutes.
Really? Okay. Time flies.
So you spoke Sunday to the church I go to, and I'm wondering, can you bring in some of those points?
Sure. I will see what I can find here. I brought those PowerPoints along with me. Probably the most important thing is the rights that have been eliminated at the federal level by executive order. And
just reversing President Obama's executive orders.
All of them that relate to LGBT people. There are about 45 I was able to make a list of.
Wow.
And as a result, what we're seeing is, I think I mentioned they scrubbed the websites. Some very important ones that were eliminated: protection of federal contracting. There was an executive order that was created called the Fair Play and Safe Workplaces Order that protected LGBT people that were working in agencies that are contracted with the U.S. government. And that is no small number. That is about 20% of the U.S. population and $500 billion worth of contracts. That was eliminated by the stroke of a pen. Equal opportunity statements, where you have an equal opportunity diversity statement in housing and urban development that says that LGBT people are entitled to fair representation and able to get housing in HUD, essentially. And that one, all of those equal opportunity statements, almost all of them, have been scrubbed from the bureaucracy. One of the ones I like the best to illustrate the the approach is the Pride Proclamation that was given for the last 8 years by the preceding president. This year, the president spoke to an anti-LGBT pride organization called the Road to Majority, and his Department of Justice secretary spoke at the Summit on Religious Liberty, and which the Southern Poverty Law Center is characterized as an anti-LGBT hate group. And I thought, well, maybe it'll get better in 2018. So what did we have for proclamations during Pride Month in 2018? National Homeownership Month, African American Music Month, National Caribbean American Heritage Month, National Ocean Month, and Great Outdoors Month. But they kind of forgot the LGBT month, and there are 14 million of us, and we were just kind of written out of those Pride Festival proclamations. Same thing with HIV/AIDS, since I'm in an organization that deals with HIV/AIDS. A number of the members of the HIV/AIDS Council resigned because they felt that the administration simply didn't care about HIV/AIDS issues. And around Christmas time in 2017, the remaining representatives were fired by a Federal Express notification. They just sent them a note and said, "You're fired," December 31st. And we had a religious liberty ambassador appointed, the former governor of Kansas, whose job it is to not only to take the information about religious liberty and apply it in the United States, but to apply it in countries all over the world. So now this idea is spreading to Hungary and Italy and all over
And
Europe.
Brazil.
Oh, possibly, who knows? And this issue is going to come up to the U.S. Supreme Court, and it won't be long because those issues were held until they had a majority on the Supreme Court. The addition of one more person has meant religious liberty cases are going to start going up to the Supreme Court, and
And a conservative majority will strike
will
them down?
probably deal with, will probably and allow them to happen is kind of the problem.
Oh,
And Title VII of the Civil Rights Act, Eric Holder was the Attorney General. He essentially interpreted Title VII. You know, it says that you're protected for race, sex, age, a variety of different protections like that. He had taken the position that people who are LGBT, which would be sexual orientation plus gender orientation and identity, that those people would be protected by Title VII, and he interpreted it in such a way as to do that. But the problem is, as soon as Secretary Sessions came into the position, then he scoped it back down to the narrow interpretation of Title VII of the Civil Rights Act. That is going to go to the U.S. Supreme Court too, and we're waiting to see what the results of that will be. We also, I'm sure, have watched all of the battles over the Affordable Care Act.
yes.
We have a higher percentage of low-income people than the remainder of the population, so those people have been able to get health care services through the Affordable Care Act. And that is one of the things they're trying to eliminate, you know, all of the things on pre-existing conditions and all of that kind of stuff that was in Affordable Care Act is at risk in this administration, and it disproportionately affects LGBT people.
Well, I hadn't realized that.
And from an international point of view, the United Nations Human Rights Council voted to condemn nations that use the death penalty on gay people. Two of those are Saudi Arabia and Iran. And that resolution passed the United Nations Human Rights Council by 27 votes in favor and 13 countries voting against that. The United States voted against.
Against?
Against, yes. And the thing that's very interesting that happened subsequent to that was that the administration has now decided to pull out of the United Nations Human Rights Council as of a couple of days ago, in the last couple of weeks. So they didn't like the interpretation they were taking on human rights, so we pulled out of that organization.
That is really really a bad
surprising,
sign.
isn't it? I didn't expect that one. I knew that we were taking that position, but I didn't realize that we would just pull totally out of that organization.
Wow.
And another thing that's important is that these changes are in the way that you interpret the law are very important to LGBT people. 32% of people in different sex couples have a college degree. Same-sex couples have about 46% of them have college degrees. But LGBT people are more likely to live in households with family incomes of less than $30,000 a year. And it's actually 28% versus 39%. And we're the 39%, and same different sex couples are the 28%. So they're also less likely to live in households with family incomes that exceed $75,000 per year. I did a study years ago on what I called it's the glass ceiling for LGBT people, and I found that in upper echelons of organizations, most LGBT people don't make it there, which is why their incomes don't exceed $75,000 a year.
Now, we have less than 2 minutes
Sure.
left.
Okay.
Let's make sure that the viewers know how to get a hold of this book.
Oh, sure.
Is it available at
There's two ways to get it. Let's put it that way. The one is to go through Routledge, R-O-U-T-L-E-D-G-E, Routledge Corporation, and just put my name into Google, put Routledge and Wallace Swan. The second way to do it is the one that a lot of people like to do, which is just type into Google Amazon, Wallace Swan, and then Routledge Handbook of LGBTQIA administration. And I've written several books, so you got to look for the one that will be the 2000.
But we can probably get it at the library, can't we?
Well, libraries have changed. You know, I teach, and I know that libraries have changed in their approach. They used to buy every book that came out. They don't do that anymore. People have to ask for the book in their library.
Yeah.
And that's what I would suggest.
Well, I'm going to ask for it.
Yeah, well, it'd be nice of you to do that, sure.
And even ask them on interlibrary loan if they don't have it in the system.
Sure. I think what we're going to find with this book is a lot of our national LGBT organizations will probably be looking at it.
Say, thank you so much.
Well, thank you very much. I appreciated it.
We could talk for hours.
Probably.